Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider. Welcome back, everybody, to Performance Medicine TV. I am jumping into Johnson City, our Johnson City location with Brittany Miller. Brittany, what's going on?
Hey, how are ya?
I am so glad to have you on the show. And you know what? One thing we got to do, Brittany, is we got to hang out more in person. Like I know this
Definitely.
is remote, and it's not as cool as us doing this in person, but this is what we got. So we're going to have a ball today.
Yeah, absolutely.
So Brittany, you're very well equipped on podiatry. Tell me a little bit about that. Tell me about your background.
Yeah, so before I joined performance medicine, I worked in podiatry in Knoxville for 7 years. So I have seen probably more feet and toes and toenails than I ever, anybody would probably ever want to, but I love it. And it's definitely an area where I feel like there's a lot of people that, need help and advice. And, I love to give that out.
I have to ask this one because I have experience with this myself. Have you taken off a lot of toenails?
Yes, absolutely. Yep.
That is, when I think about like trauma in my life, it's getting my toenails taken off. My dad did it one time, and man,
goodness.
it was a trip.
I think the good thing, for me, and when you have the right tools and the right kind of setting, we could try to make it as little traumatizing or as least traumatizing as possible.
Well, there's another traumatizing thing around toenails, and that is fungal toenails. I've heard, I've heard Dr. Rogers talk about this a little bit. Let's kind of educate the audience on fungal toenails, what to look out for, and how do you know if they're infected?
Yeah, absolutely. So, any kind of change in the appearance of our toenails can make us think that, hey, we might have a fungal infection. Fungus is an organism that thrives in warm, moist, dark environments. So kind of the inside of shoes is a perfect place for fungus to get in and set up shop. Toenails are also a perfect place for fungus to grow because they're hard, they're made of keratin. They're meant to protect our toes and our fingers. But once fungus kind of invades there and sets up, it's very, very difficult to get rid of it for that reason. So the big thing, or one of the big things that you want to do for fungal toenails, is kind of get on top of it before it becomes a big problem, or before the infection has really progressed and has gotten really bad. So looking for the early signs of a fungal infection are important for that reason. And so some of the early things that you might notice are kind of just a different appearance. You might notice like white spots on your toenails, and it could be one toenail, it can be multiple toenails. I tended to see that it was big toenails kind of primarily started out, with the infection first. But it can start as little white spots. It can start as a thickening of the nail. It can start as kind of like striae or stripes in the nail. And then eventually, as that fungus kind of grows and progresses, the nail will get big and thick and kind of crumbly and just kind of be kind of a big, thick toenail.
Now, one thing I was thinking is like, why is this a big deal? Like, is this something that you can ignore, or is this something that is a symptom of something bigger? Like, does that make sense?
Yeah. So the answer is kind of yes and no to that. Fungus is something that in most cases, technically you could kind of live symbiotically with. If you're a healthy person, even if you're an older person and you're in decent health, fungus can live in your toenails. It's not going to kind of jump ship and move to other parts of your body. It wants to stay in toenails because that's where it grows well. And it can, you can live with it. Now, if you have some kind of like underlying medical issue or medical condition, which makes you kind of more susceptible to infection or can kind of worsen your course if you do get an infection, like let's take diabetes, for example. Diabetes can not only kind of predispose you to fungal infections, but if you were to kind of let that grow and check, and let's just say it got bad enough on your toe that it caused a wound or it caused, problems down there, then you could get really bad complications from it. So, healthy people, no, technically you don't have to do anything about it. Certain populations do, should get it treated. But at the end of the day, it's also kind of how you feel about it. If you don't like how it looks or if it's causing pain or problems, then that's also a reason to get something done about it.
So initially it can start off as white spots. It could start off as maybe thickening of the nail. What about, from personal experience, Brittany, is a yellow nail, is that bad?
Yeah, absolutely. I
Okay,
mean,
so
sometimes yellowing of the nail can be a sign of fungal infections as well.
that's super interesting. And how do you go about, like, in every case, do you need to remove the nail, or is there certain like treatments you love?
Yeah, so not necessarily. So depending on kind of the how bad the nail is, what the nail looks like kind of to begin with, and how many nails are affected, that can kind of help us make a decision on treatment. And I kind of always went at it in a stair-step approach. So if you have an early infection, if it's just kind of a superficial infection, if you only have one or two toenails affected, topicals sometimes can be affected. And that's going to be our, like almost like a clear polish that you would paint on every single day onto the nail. Now, the problem with treating toenails, and this is true whether you're going the topical route or some of the others I'll talk about in a second, is that nails are tough, they're hard, they're made to protect our fingers and toes, like I mentioned. And so any time that we're treating them, it's a long process to treat them. And so with a topical, you're treating anywhere from 3 to 4 months initially, and sometimes even longer than that, depending on, how you're responding. Most topical treatments will have not only the antifungal agent themselves or itself, but also what's called a keratolytic. So essentially it's something that kind of breaks down the keratin or the top layer of the nail to allow that antifungal to penetrate the nail and really be effective. So that would be kind of the first option.
Okay, what was that second one, Brittany? The nail polish was first. Is like a clear polish, and what was the second one?
Yeah. So if you fail topicals, or if your treatment is too or your infection is too far progressed for the topical to be effective, your next step would be to do something like an oral treatment. That's going to be like our terbinafine or our kind of traditional oral antifungals. Again, that's at least a 3-month course. And I will say that there are some patients that you want to avoid those in, and that's because they can be pretty tough on the liver. So anytime, you're starting somebody on an oral antifungal, especially somebody with, maybe comorbidities or health just not great in general, you want to check their liver function just to make sure there's no problems there to begin with.
That's super interesting. And one thing you said that I keep, you said a couple times today, and I didn't realize the function of the toenail is to protect your toes and fingers. Is that right?
Yeah, just kind of, added protection for, things we do with our hands, things we do, with our feet being inside shoes. They kind of take the brunt of what kind of could cause a lot of pain and problems if we didn't have them.
That's super interesting. That's super interesting. Okay, so we went over topicals. We've gone over some antibiotic type treatment for fungal toenails. Is there any other thing that you go about with treating a fungal toenail?
So a lot of times, kind of the ultimate treatment is toenail removal, and we can talk about that in a second. But if we're trying to avoid that at all costs, one of the things that I do talk about with pretty much every patient is kind of reducing the risk of a fungal infection. I mentioned that fungus thrives especially toenail fungus, in the kind of environment that our shoes create for it. So that warm, moist, dark environment. And so there are things that you can do to kind of reduce the risk of picking up a fungal infection. One is to make sure that you are kind of decolonizing your shoes periodically, and that's as simple as just spraying some Lysol in there like once a week just to kill anything that might be living in there. Another thing is to wear 100% natural fiber socks, so like a merino wool or cotton or something like that, because they're better about wicking moisture away than like our polyester or even our blends. So both of those things can kind of help decolonize and help, reduce the risk of getting an infection. Another thing that you can do is really just kind of generally support the health of your nails. And that can be good kind of vitamin support. B vitamins are great for supporting healthy nails. Making sure that you're just taking good care in general. And then kind of the ultimate fix, I guess, is the removal. If all else fails, that's kind of when we would move to that.
Brittany, you did it. You triggered me. Like now my brain my brain's going back to that time. Tell us a little bit about this procedure, and
Yeah.
is this something that you can even do in a performance medicine setting, or is this something that happens more in podiatry, the specialty?
So in general, you need a specialized group of tools if you're going to do it well and do it right. And we're kind of working on getting that at some point. So right now I can't, but in the future, absolutely. And essentially, there's a couple different kind of versions of the procedure. There is a partial or a permanent, or sorry, a partial or a total or version of the procedure. With a partial, let's just say you have like an ingrown toenail only on one side. You can remove a piece of the toenail and never have it grow back. When we're talking specifically about fungus, though, it tends to be the entire toenail that's infected. The surefire way to get rid of that fungal toenail is to remove it in its entirety. That kind of cures the fungus instantly. You're removing the diseased nail, and then you can do that either as a permanent or a non-permanent procedure. Most young, kind of healthy people start with a non-permanent procedure because we want to give that nail an opportunity to regrow and kind of, as a healthy non-fungal toenail. Some people, though, that maybe have dealt with this issue for a long time or maybe have had it removed previously and it regrew and ended up back in the same boat, elect to remove the nail permanently. And that is so they don't have to deal with it anymore and they're done.
I thought about that option. I had my big toenail removed twice, and I thought about that option. I didn't go with it. Is there any consequences for choosing to do that? I know they go a little bit deeper, might be a little bit more painful to go through, but is there any consequences?
So the procedure itself is actually exactly the same as far as the removal goes. And then you use essentially just some kind of agent just to kill the root so that the nail can't regrow. So that is the difference there. And so some people do have a little bit more pain afterward during the healing process, just because the agent that's used to kill the root can sometimes, irritate the tissue around there too. As far as kind of long-term consequences, I mean, we talked a little bit about nails being there to kind of protect your toes. If you were to drop something without a toenail there, you lose a little bit of that protective aspect, but that's pretty much it.
That's super interesting. And I mean, the reason I had mine taken off was ingrown toenails. Is there, and now, guys, I apologize, I'm getting super selfish. Is there a best practice for cutting your toenails? Like the way you go about it? I've always heard go straight across.
Yeah, so in general, you don't want to kind of cut down deep into the corners because sometimes you can stimulate an ingrown toenail to form. And I guess one thing I will say is that an ingrown toenail in and of itself may not be a big deal. If you have a nail that's maybe ingrowing but isn't painful, I always tell people just leave it alone. Don't kind of try to cut it out unless it's painful. Once it becomes tender, though, my kind of go-to, and I will say this is not only with patients I've dealt with, but I deal with it myself personally, is I always recommend, people kind of trying to use their fingernail to free up that edge of the nail first. So kind of rather than using a tool, using a cutting instrument where you can break the skin and introduce infection, try to free up that edge of the nail first and then take some ibuprofen or some anti-inflammatories because the pain that you're feeling is usually inflammatory pain. And so if you can reduce that inflammation, if you can free up that edge of the nail, 9 times out of 10, that kind of takes care of the ingrown toenail. But then if you kind of get into a process where you're doing it all the time, where it's becoming painful no matter what, or you're kind of, like you said, cutting straight across, not cutting into corners, and you're still dealing with it, that's when a podiatrist can absolutely help you out and get rid of it.
That's super interesting. And one more thing, Brittany, that's, again, kind of personal. I'm wearing no socks with my shoes right now. Is that a recipe for fungus?
So, I'd say yes and no. If you're, like we talked about, if you're decolonizing your shoes periodically, that will absolutely help kind of keep you from getting an infection. Socks, as long as you're wearing the right ones that wick moisture away, can help you. But in general, you want to have the socks on, I would say. Yep.
Dang it, Brittany. I'm gonna have to change up my routine here. But Brittany, I tell you what, I appreciate you so much for explaining this. Is there anything else that you feel the listeners need to know about fungal toenails? I had this written down for one of our listeners is around toenail polish. Is there
Yeah.
anything that you like or dislike around toenail polish?
So I had a question recently about, whether toenail polish can cause you to get a fungal infection. Whether if you're putting toenail polish on your toes, you can stimulate a fungal infection. Essentially there's a couple kind of things that I always caution people with or tell people when I'm talking about putting polish on. I get pedicures, manicures, I think that's definitely something people should continue to do. But there's a few things that I, will caution people about. Make sure that, when they're putting on the nail polish, whether it's gel polish or regular polish, they're not roughing up the nail too much. Because some people kind of take a Dremel tool, they'll kind of rough the nail to get the polish to stick better. That can kind of damage or compromise the integrity of the nail itself. And anything that compromises the integrity of the nail can make it more likely to cause a fungal infection or for a fungal infection to set up shop. The other thing is that once you have that polish on, it kind of, if you have a fungal infection, that polish is essentially allowing the fungal infection to grow unchecked. If you don't have a fungal infection, that's kind of creating an environment where there's not much airflow, there's not much, it can kind of make your nails a little more brittle, and that can also allow fungus to get in there. So change nail polish at least every 2 weeks or so, I would say. And that just allows nails to kind of air out, to get a little bit of a rest.
So are you saying go 2 weeks off, or so like if you put on toenail polish, give it a rest for a week, or just change it up?
No, it's more just make sure that you're not leaving it on for more than 2 weeks at a time. Just that you're removing it, allowing that nail to breathe, even if it's just for a little while, and then letting your body get back to normal.
Is there anything, because I see this with women more often than men, but filing your nails, is that bad? Could that compromise anything?
Not really. I think as long as you're using a good file and when you're clipping, just good sharp clippers, no, I think you're fine to do that.
Well, Brittany, this has been super insightful. I'm still back about a decade ago when I was under is it a knife? I don't know what it was, but I tell you what, it was so painful.
Uh-huh.
But I'm okay. We made it.
That's right.
I'm able to move well now. But is there anything else you want to cover before I let you get back to seeing patients?
As far as fungal toenails go, I think that's, definitely the kind of bulk of it, all the information people would want to know. If there's questions, though, people have, I'm happy to answer those at any point.
Brittany Miller, thank you so much. Thank you for joining us today.
You're welcome. Thank you. Absolutely.